Welcome everyone. Good afternoon. It's officially afternoon, middle of the week. Happy hump day, everyone. It is Wednesday, right? I think so. Yeah. Okay, good. All right. So it is my great pleasure to introduce Dr. Bonnie Halpern-Felsher, who is a tenured professor in the Division of Adolescent Medicine, Department of Pediatrics, Stanford University. She's also the founder and executive director of the Tobacco Prevention Toolkit, the Cannabis Awareness and Prevention Toolkit, and the Vaping Information Solutions and Interventions Toolkit. Dr. Halpern-Felsher is a developmental psychologist with additional training in adolescent and young adult health. Funded by the NIH and many foundations, her research has focused on understanding and reducing adolescent tobacco use, alcohol and marijuana use, and risky sexual behavior. Her research, including over 170 publications, committee, and advocacy work, have been instrumental in setting policy at the local, state, and national level. She has served as a consultant to a number of community-based adolescent health promotion programs and has been an active member on several national campaigns to understand and reduce adolescent tobacco and e-cigarette use. She has testified in several states and at the FDA arguing for more tobacco e-cigarette regulation, served on 6 Institute of Medicine National Academies of Medicine committees, and contributed to 3 Surgeon General reports, all focused on reducing adolescent risk behavior and promoting health. It is a big honor to have you here today. And I will mute myself and give the floor to you. Let's all welcome you to today's CAP Grand Rounds. Take it away.
Thank you so much, Dr. Stewart. And hi, everyone. Great to see you. Some of you I know, and some of you are new faces. So excited to see you and speak to you about this topic. I'm going to dive right in. Please do ask questions. Maybe wait till the end for the conversation. I will leave time. I have a lot of slides, but a lot of them are pretty quick slides, and you are welcome to have copies of the slides. Anything I talk about, any data I talk about, please shoot me an email. My email will be at the end, because everything we do in my lab is shareable. We're very much open to the community and helping with this problem. So let me share my screen and get right into it. All right, are we good seeing screens?
Yep, all good.
All right, awesome. All right. So first, just want to thank my lab. I have a pretty large, very, very fortunate to have a lovely large lab of staff, postdocs, and then faculty who are affiliated with the lab who help with all the work that we do. I want to give special thanks to our funders, without whom, of course, we couldn't do our work. And then just a pause on a couple of quick disclosures. This is always the slide that people laugh at and go, but I do actually have some disclosures that are important for me to name. A couple were mentioned, but just really quickly, I am a paid expert witness in some litigation against the e-cigarette industry. And then I also am an unpaid expert and scientist in some city, state, and federal level policies. So wanted to make sure people are aware of that. All right. Learning objectives to understand the different tobacco and vaping products that youth are using. This will be focused on youth and young adults, but I'm happy to answer questions at the end, going younger and older. Understand the, Sam, you pointed that out to me and I didn't fix it here. Understand the reasons youth are using these products. And then, sorry about that, I'll try to fix it on the next round, and then hopefully that you can leave with some resources and tools. All right, so let's start it. And by the way, for those of you who like to play along, there are a few kind of pop quizzes that it'd be fun if you put some thoughts into the chat as we go. So first of all, let's talk about the e-cigarette products. I'm sure you're all familiar with cigarettes and cigars, but you may or may not be as familiar with the e-cigarette products. So let me just spend a minute here. First of all, terminology. You're going to hear me use the word e-cigarettes for the most part. I will slip to the term vaping at times, but I tend to and try to use e-cigarettes. Why? The e-cigarettes came on the market in the United States in 2007. Not very popular, and we'll talk about the different products. They weren't very popular with teens then, weren't really popular, period. Took off more around 2011, 2012, 2013. But they came on in their term e-cigarettes. At some point, a couple years into it, the term vaping came out. Vaping, we think, was an industry term. And it was used, we think, to not have the word cigarette attached to these products. And so as a public health person, as an academic, as a researcher, in a more formal setting like this, formal meeting colleagues, I will use electronic cigarettes or e-cigarettes or e-cigs. But I will tell you, and we talk about this a little bit more at the end, when you talk to youth, to your patients, to your parents, to the community, then we do need to use the term vaping or combination, because we did this great study where we asked teens, what do you call these things, or tell me about an electronic cigarette? And they looked at me, like I was crazy, and they don't call them electronic cigarettes. But I stay strong in my advocacy that they are still cigarettes. Okay, so what are we talking about when we talk about these products? Well, what we're really talking about here are what came on the market in 2007 were these products that had more of a cig-alike look to them. So they were disposable, so they look like cigarettes. When you were done using them, you threw them away. They were not very attractive to young people because teens don't want to use cigarettes. That's our good public health thing that we have done. That's great. Teens don't want to use them. They didn't have a lot of nicotine delivery and not a lot of flavors. But then fast forward a few years, we have these vape pens and these mods because you can modify. So these products have a button. The disposables, the early disposables were pre-filled with the e-juice, the nicotine and constituents. These later models that came on the market a little bit later, you poured in from a little container, a little bottle, the e-juice that went in. So it had the nicotine and all the chemicals, and I'll show you some slides on that in a little bit. Press a button and inhale the aerosol. Teens started using those, and we'll look at some of the data and the epidemiological and the data on that, but they didn't last for very long. You still see them as times, but they weren't as popular. But these were the products that had that huge plume of vapor or aerosol. It's important, it's not a vape. That's the other reason why I don't call them vapes, they're aerosols. Had this huge plume of aerosol, and my current 21-year-old, when she was in high school, would say, yeah, you can go on YouTube and there are all these contests for aerosol blowing or smoke blowing contests with these. All right. These were popular with teens, but not as. Then Juul came on the market. I'm sure you've all heard of Juul. Juul was the first pod-based product to come on the market. It had these little pods. The pods are pre-filled with the e-liquid, and then you have this vaping device here. After that, and we could talk about regulation and advocacy and policy work towards the end if you'd like. I'm not going to go into it a lot right now, but for various reasons, then we had Puff Bar come on the market. So Juul was the most popular product ever and used in the past month. Now it's still the most popular product ever, but current use, past 30-day use, is more Puff Bar, this new product called Flume, and Soren and other products. So when you're thinking about it, and those of you who are interested in advocacy, it makes it really hard to advocate for products that are constantly changing. All right, so let's talk about use rates of electronic cigarettes. So this slide is from the National Youth Tobacco Survey. It is the kind of most relied on surveillance of adolescent tobacco use, middle and high school students. What you would see here are data from 2011 to 2019. The good news, what we're seeing on the far left, the pretty sharp decrease in the number of adolescents. These are high school students I'm showing you here. And the number of adolescents to use a cigarette, a combustible cigarette, in the past 30 days. So by 2019, across the country and a lot in California, or very much so in California, we were down well below double digits, right around the 5 to 6%. That's the good news. The not good news is what we see on the right, which is the significant increase in the number of youth reporting using an electronic cigarette in the past 30 days. And what you see is particularly stark is from this purpley color in 2017 to the salmon and to the light green. You see a dramatic increase to 20% and then almost 28%. This represented a 78% increase in the percentage of high school students who reported using an e-cigarette in the past 30 days. And I'm not showing you the data here, but the corollary for middle school was 48% increase. So this was astonishingly high numbers. And these numbers really led a lot of people, and particularly Scott Gottlieb, our then FDA commissioner, and then Dr. Jerome Adams, the then Surgeon General, in 2018 to call this a vaping epidemic. Then we have 2020 data from the National Youth Tobacco Survey, and the 2020 data are starting to look a little bit more promising, where our numbers are 20% of high school students and almost 5% of middle school students using these products in the past 30 days. What's important to note is this still represents 3 million high school and a little more than 500,000 middle school students. But what's also really important to note is these data were collected at the beginning of the pandemic. The National Youth Tobacco Survey comes out from around January to around March or April of each year. Of course, you know what happened in March of 2020. We all went into sheltering in place. So the data collection had to be cut off. And because students were starting to go and be home more, that they were not socializing as much and using electronic cigarettes. And we'll talk about reasons and socialization a little bit more. But some potential good news happening there. 2021, we also see a drop around 11% of high school students and almost 3% of middle school students. But another big caveat, these data were completely collected during the pandemic, not in school. So I would say not very representative of what we're seeing with students and youth across the country. I will also tell you that these numbers are not what we're seeing today. It's just that the national data have not necessarily caught up to some local data. And I work with hundreds of schools on a fairly regular basis. And a lot of schools are saying we're back in school and we're seeing vaping or e-cigarette use go up again pretty dramatically. And I'll talk about that a little bit more as we go. But while some potential good news, and I'm optimistic that there may be some good news, I'm not so optimistic in what I'm seeing in reality on the ground with youth and in schools. There's still a lot of work to be done. I do want to touch on a few other vaping products that are not nicotine products because I think they're important. First of all, if you didn't know, you can vape your THC or your CBD. You either can buy a separate vaping device that's specifically for THC or CBD, or you can take a Juul, you could take a Soren, you can break them apart. It's not very hard. A quick YouTube video shows you how to do this. Sadly, you break them apart and then add in the THC wax and oil into it and be able to use it that way. It's a very common way for young people to be using their cannabis. The THC concentrate is then aerosolized. It takes about 5 to 10 seconds to feel the effects, similar to nicotine. The high lasts 30 minutes to several hours. And then, of course, the THC concentration just depends on the flower and the liquid. This is not harmless. Just because you're not burning and combusting something, the THC is still there, still has all the same concerns as does nicotine, and so on. So just to give you a little bit of numbers here, a little bit older data, but basically we were seeing in terms of the co-use of vaping and cannabis, about 33% of high school students who ever used an e-cigarette reported using cannabis in that e-cigarette. And that's true for about 23% of middle school students. So we know that youth who vape are about 3.5 times more likely to use cannabis than those who don't. So important when you are talking to patients, when you're talking to youth about e-cigarette use, to find out what they're putting into their e-cigarettes. It may not be nicotine, it may be cannabis, it may be some combination. So important for your screening questions. Just want to show you some pictures so you can get a sense of what these products are. Here's your Juul. Here are your Sorens. Here's what's called Smoke, SMOK. Here are some other brands, various miscellaneous. Puff Bar, you can see this picture was taken on my kitchen table just before the pandemic. Some schools like to give me what they confiscate. One, it allows me to have not free samples for myself, I promise, but to be able to share with schools and with parents so they know what these products look like. But also it allowed me to take a picture to say, whoa, we're now worrying about Puff Bar, not Juul. That was the change. But I also am showing you On the left are the cannabis products. And you can see they don't look that different. And I'll show you in this next video, if you can see here, that the cannabis and nicotine vaping products and also other kinds of tobacco products look fun, look enticing, and don't look that different from each other. So it's very hard sometimes to know what youth are using and what's in that nicotine, or excuse me, what's in that tobacco device, a vaping device. Come on, move. All right, I also just want to tell you about some non-nicotine vaping devices that we're seeing become very popular. I've been hearing these referred to as wellness products or wellness vapes. Please don't call them that. Let's not perpetuate and become part of the problem by calling them wellness. They are not wellness. These are vaping products that don't have nicotine, or to our knowledge, don't have nicotine. They're still in the testing phase, but you can vape or use caffeine, you can vape vitamin B12, you can vape melatonin, you can vape pretty much anything right now. And these products either look like the old cigalikes or like the Juul or Puff bar. They become very popular. We had no data on these. We actually in our lab have hot off the press data I'm going to share with you. These are about to be in review. We collected data in December of 2021, I have to remember where we are, of a national convenience sample of adolescents, young adults, and adults, so 13 to 40-year-olds, over 6,000 in our sample. And what we found are, the every user, 25% are every users of e-cigarettes. But what I want to point your attention to are those who have used these non-nicotine vapes. The non-nicotine, 26% have ever used a non-nicotine vape. And at the bottom, you have it broken down by age. So in that 13 to 17 range, 14% have ever used a non-nicotine vape, 11% in the past 30 days. While those numbers are certainly not at the level that we're seeing nicotine vaping products, they're still very high. And there's a lot of concern that that's going to increase as young people start hearing about these products more. The 18 to 20-year-old is 31% used ever and 26% in the past 30 days. And then a little bit lower, but still high numbers for young adults and adults. So these products seem to be very popular, and it's something that we need to keep an eye out. All right. So I'm going to turn to a few slides on tobacco use and the pandemic, because I get a lot of questions about it. Dr. John Ma is on. He and I have had numerous conversations about concerns with tobacco use and this pandemic. So if you look at most of the literature that are on there, he didn't tell me to give him a shout out, but I know he's there. Many studies have focused on tobacco use and COVID-19 outcomes, including infection or whether you're testing positive for COVID-19, but also severity of those symptoms, and then death. Most of the studies that are out there have focused on adults and on cigarettes. So we did arguably probably the first study of data to really start honing in. And since then, there have been more studies, but I'm going to talk a little bit about it. So why are we concerned at a more theoretical level about smoking or vaping? And I am going to use vaping here and COVID-19. Well, we know that any form of inhalation, whether it's THC or whether it's nicotine and in any form, can weaken the lungs from breathing in that smoke or the aerosol. We also know that the novel coronavirus attacks the lungs. And we know that if you have weakened lungs, that you're at greater risk for more infection. Slide move. There we go. So what did we do? We wanted to look at self-reported changes in tobacco use before and during. I wish we had an after. There is no ACS yet. We're still BC before COVID or DC during COVID pandemic, but we want to look at self-reported changes in use, reasons for the changes, and then ask whether there is a relationship between tobacco and COVID outcomes, and then identify some of the products that youth are using. And just a quick shout out to Shivani Geha, who's first author, now an instructor, was a postdoc in my lab, and Lauren Lempert, who straddles between Stanford, my lab, and UCSF at the Center for Tobacco Control and Research and Education, and she's our director of policy in my lab. So just in brief, it was a national cross-sectional study in May of 2020. So just shortly after we closed down as a country around the pandemic, we used quota sampling for age, sex, race, ethnicity, and we oversampled 50% of e-cigarette users because we really wanted to understand e-cigarette users' patterns. And then we deleted participants if they completed the survey too quickly, if it was clearly a bot. I'm seeing a chat. I'm just seeing if this is something I need to worry about now. Oh, thanks, John. So participant characteristics, this was a sample of 4,300 participants, relatively evenly distributed by the 3 age groups. So we break them down, by the way, this way: 13 to 17, in pretty much everything we do in my lab. 13 to 17 are under the legal age for most things, with 18 being the legal age for most things. 18 to 20 are young adults. But then we break apart 21 to 24 because the legal age to purchase or be sold to really a tobacco product and a cannabis product in California and across the United States is 21, hence why we break down the group. And you could see the racial, ethnic, and gender diversity there. All right, so first of all, we looked at the changes in e-cigarette use during the pandemic. And like I said, you're welcome to have any of these papers if you want. Just shoot me an email or find them on PubMed. But the self-reported changes in e-cigarette use, what we found is amongst the 56% of our participants who were using and reported some change, that about a third said that they were quitting during the pandemic, again, in May of 2020. So we asked about the past month, so around April of 2020. About a third, and about a third said that they were trying to reduce their vaping, their e-cigarette, nicotine e-cigarette use. That's great news. So we were seeing a significant number of young people who were quitting or trying to quit. The struggle, though, is that, and this is really important for this group here, is that those who were the least likely to quit were those who were using electronic cigarettes pretty regularly, so 11 to 100 times, or we measured nicotine dependence using the Hooked on Nicotine checklist, and they were 51% less likely to quit if they endorsed some of those honk dependency items. So while a third are quitting and about a third are trying to quit, we see that those who are quitting or trying to quit seem to be those who are less addicted, and those who are more addicted are struggling more and need more support. And we'll talk about that a little bit more, but definitely some concerns there. Now, I was also part of another study with a group at UCSF where we looked at these data that you're looking at, this slide, are longitudinal. And we have a cohort that we've been following before and during the pandemic. And so we were able to look at changes in e-cigarette use as well as cannabis and physical activity, but before the pandemic and then during. And what we found there is that the e-cigarette use seemed to be decreasing even prior to the pandemic. And that's good news. And I'll talk about this a little bit more, but I think we finally are starting to get the message out there about lung health and our concerns over it. So maybe that is a good trend that we're hoping to see. But this is really one of the few longitudinal studies to show that this trend of decreased e-cigarette use may have already been happening. Hot off the press just this week, some new California data published by Westhead, that they did a lovely fact sheet and looking at reductions in vaping during the pandemic. And they showed also significant reductions during the pandemic. But what was concerning is that they found that those who were fully remote in their education had the lowest vaping rates. Those who were either hybrid, so partly in school, partly out of school, or completely in school, were not decreasing their e-cigarette use. And it comes back to the social aspect. Teens share their vaping devices. Teens influence each other as being popular. Let's get together, let's have a party, and let's use our e-cigarettes. So what about this relationship between smoking, e-cigarette use, and COVID-19? So again, we really published one of the first papers out there that looked at e-cigarettes and youth. Since then, there have been many other studies, but at the time. And the bottom line is that we found a pretty significant relationship between those who have ever or in the past 30 days smoked, vaped, and had presence or absence of COVID-19, not severity. We didn't ask about that. We didn't ask about hospitalization. So if you were using both products, you were over 4.5 times more likely to have symptoms. Now, this is important. Realize that the symptoms of COVID, particularly early on, are symptoms that young people are reporting if they're using electronic cigarette: headaches, coughing, trouble breathing. So what we think was happening is that young people were having those symptoms, and then they were more likely to test. Remember, this was a time that was hard to get tested. Maybe they were calling up their healthcare provider and saying, I'm having trouble breathing, I'm coughing, might I have COVID? And so they were invited in to get tested. But what's really important, and the most important finding, is that if somebody was using e-cigarettes ever, or using both e-cigarettes and cigarettes, they were 5 to 7 times more likely to have been diagnosed with COVID-19. Important, again, not severity, just simply diagnosed. Now, I get a lot of people who say, well, why are you blaming it on vaping when you're showing dual use? Because the predominant pattern of use for adolescents and young adults is e-cigarette use. The dual uses, they tried a cigarette once. They tried it a couple of times, but their predominant pattern of tobacco is e-cigarettes. So why are we seeing this? Well, it may be lungs, but what may be happening is the repeated hand to mouth. You know, you touch a doorknob, you touch your vape, you touch your mouth, and you're infecting yourself. You have to remove your masks to use tobacco in public. We know that sharing of vaping devices is very common, especially among young people. So they'll pass them around. And I've had young people say, you know, recently we did some qualitative work, and one young person up in rural California said, yeah, I'm vaccinated, but my friends aren't, but we all share our vaping devices. And you're going, no wonder we're seeing a big increase in in COVID amongst our young people. And then feeling stressed, and we'll talk about that a little bit more, but young people are so stressed right now during COVID that they're using their vaping devices to manage their stress. You know, as with any study, these were limited, self-reported data, correlations, convenience, but I think it's still strong. And since then, there have been a lot of other studies showing a very strong relationship between smoking cigarettes, vaping e-cigarettes, and the presence or absence of COVID, as well as symptoms of COVID. All right, so let's talk about what's in an e-cigarette. So here are some of the chemicals that are found in the variety of e-cigarettes or pod-based aerosols that are out there. And I don't know about you all, I've been doing tobacco control work for about 25 years and tobacco research for 25 years. I used to show this as a slide for cigarettes. It's not that different. You know, maybe instead of thousands, we're looking at hundreds of chemicals, but a lot of the same chemicals that are in cigarettes are in electronic cigarettes: lead, cadmium, benzene, formaldehyde, etc., are in these products, and that's a big concern. The other big concern is the amount of nicotine and why we're seeing so many young people addicted. And this is really important to note. All right, so when you're talking about a pack of cigarettes, you may know that a pack of cigarettes has 20 cigarettes. Each cigarette has 8 milligrams of nicotine, but the yield, or the amount that you actually take in, isn't very good. Even though they're efficient at delivering nicotine to your brain, the process by which that happens is sloppy in some ways. You know, a lot goes in the air, in the ashtray, in your fingers. So if you're going to smoke a pack of cigarettes, you're going to get about 20 milligrams of nicotine into your body if you smoke the whole thing. All right. Juul pod. Juul pods have 59 milligrams of nicotine per milliliter, 59 milligrams per mil. It's a 0.7 mil. So you just multiply, sorry to do math during lunch, but 59 times your 0.7 gives you about 41.3 milligrams of nicotine. Juul used to, they took it off their website, but they used to brag that you get at least 80% of what's in their Juul pod into your body. So my lab would argue that if you're going to vape an entire pod of Juul, that you're going to get about 41 milligrams of nicotine into your body, a little more, a little less. You're going to get about 41 cigarettes worth of nicotine. Now we've softened this to saying instead of 2 packs of cigarettes worth of nicotine, it's 1.5 or so, because we got a lot of pushback. We got pushback, by the way, because the Juul website says 1 pack of nicotine of cigarettes worth. And, I said to my public health friends, are you going to believe Juul? You're going to believe the scientists out there, but whatever. It's a lot. Puff Bar has 50 milligrams, so closer to 50 cigarettes. Soren has even more. It's a bigger volume. So you're looking more like 90. So a huge amount of nicotine. But also what's important is these newer products have a salt-based nicotine. What does that mean? So the earlier e-cigarettes, as well as cigarettes, have what's called a free-base nicotine. So free-base nicotine are very alkalinic. They're very basic. They're very strong on your throat. People talk about a throat hit when you use these products. And that's because they use sugars and ammonia to combine and bind to the nicotine and allow it to go through your body and into your brain in about 10 seconds. What happened with Juul, they patented a salt-based nicotine that's since been used by most of the other companies. And this uses salts and in the form of a benzoic acid. So what you're doing is you're adding acidity to it. So you're moving think of the litmus test, you're moving from, around 7, 8 on the basic side, more towards the acidic, but not acidic. You're actually moving it more towards neutral. So what happens is it's not as strong. So people report that they don't have that throat hit. It's not as painful. So why do we care? I'm a youth person. That's my focus, is adolescents and young adults. Most teens and young adults today are starting tobacco through electronic cigarettes. Those data I showed you at the beginning and the epi data, they're starting through e-cigarettes, not through cigarettes. So if you're a young person and you take an e-cigarette and you've never used a cigarette before, you're not used to the throat hit. So if that e-cigarette hurts your throat, you don't want to use it. Juul's e-cigarettes were smooth. They were pleasant. They had lovely flavors, and we'll talk about flavors more in a minute, but all these lovely things about it that when you took it in, it didn't bother your throat. Plus, a salt-based nicotine gets absorbed better and faster through the system. So you've got a combination of salt-based nicotine, better absorption, no nicotine hit or throat hit or very little, and lots of nicotine. It's not surprising that young people are becoming addicted. Then you might be saying, well, how much nicotine or how many pods are young people using? You may see differences in your practice. Some of the studies we did showed that they're using about anywhere from a pod a week to a pod a day. A pod a week, think of it as about 3 cigarettes a day, still a lot for a young person. A pod a day, think of it as at least a pack of cigarettes, if not 2 per day. Some of the teens I've talked to who are addicted, really heavily addicted, are using 1 to 4 pods a day. Think about that. That's 1 to 8 packs of cigarettes worth of nicotine, depending on how you do the math. Huge amount of nicotine. All right, so why are we concerned if I didn't convince you enough? First, the brain. You all know that nicotine rewires the brain and changes the brain, no doubt. Heart beats faster, flight or fight response, and then lungs, and we'll talk about lungs a little bit more. But for the brain, that's why we know that young people under the age of 21 start, and that most adults who are addicted to smoking or any form of nicotine started when they were teenagers or very young adults. And tobacco industries know this. They're targeting, and I'll show you some of those egregious pictures, they are targeting young people because they know if we get you to use our products and get you addicted, we've got a lifelong of addiction and you're using our products for a long time. We also know that very few 30-year-olds suddenly pick up a cigarette and say, or a vape and say, ooh, I'm going to use this, and very few become addicted. This is a disease of adolescents and young adults. So what about the lungs? Well, we know that tobacco in any form inflames and irritates the airways and destroys the air sacs in the lungs. We also know that you're more likely to have a weaker immune response to infection if you are using a form of tobacco, inhaled tobacco. And we think this is a lot of why we're seeing not only more likely to get COVID-19, but more likely to be sick and be hospitalized or even die. with COVID-19 because of the lung damage that particularly smokers, but also vapors have had. I actually know some physicians back east who work with youth surgeons who won't do elective surgery on a teen who's been vaping because of some of these concerns. We also know that there are other pulmonary effects just from the flavors, and we'll show you flavor slides in a few minutes, but just the flavors themselves. We know in animal and human studies that when you're using some of these flavored products, that you're more likely to have respiratory illness, life-threatening respiratory failure. A lot of this is due to the diacetyl, the buttery flavoring agent that's often seen in popcorn. Look, there's a term called GRAS, generally recognized as safe. You can heat butter, you can heat popcorn, you can heat cinnamon or vanilla and eat it, and it's safe. You can heat pretty much anything, but heat it to 200, 300, 400, 600 degrees, which is what's happening with a vaping device, and you breathe in the resulting aerosol, that is damaging your lungs. And that's where you need to think about these things. Now, you may have heard of EVALI, e-cigarette and vaping-associated lung illness. Some of you may have even had patients with EVALI. This was happening in 2019 into early 2020. Unfortunately, the CDC stopped collecting data after February 2020. Okay, granted, they had something else to worry about in terms of COVID-19, but I've seen a lot of, I talked to a lot of pulmonary docs and emergency room docs who say that they're still seeing EVALI. In fact, I gave a talk this morning to our peds residents and they said, yeah, we're still seeing EVALI. We don't have a lot of data anymore because the CDC is not collecting the data, but it seems like a lot of it had to do with the THC in a lot of the devices or the vitamin E acetate. But there are some young patients, and this was an adult issue too, but some young people who said, look, I've only used nicotine vaping devices. I'm not using THC. So there's a lot of concern around lung illness, period, around e-cigarette use. We're also concerned because adolescents who start with e-cigarettes are 4+ times more likely to then start using a cigarette. And that's a really big concern as well. So why are youth using? There are a lot of reasons. I'm going to focus on a few. First, flavors. And this is your first pop quiz if you want to throw in while I'm talking. Throw into the chat. John, you're not allowed, but everyone else. How many e-cigarette flavors do you think are on the market overall? Not just Juul, but overall. So why is it that teens use? Well, we know from the research that we published and others that flavors mask the harsh taste of tobacco. We know that if it smells like tobacco, it's probably gross, and we've been teaching teens not to use tobacco flavors. But if it smells good, if it smells tasty, if it smells like fruit, then it makes it easier to hide from parents. It also makes you think that it's okay to use. And that teens tell us that they're more likely to use a tobacco product if it's flavored. Keep throwing in some of those numbers. How many e-cigarette flavors do you think there are? We also know that youth will quit using e-cigarettes or any tobacco if the flavors weren't there, and that the ads and packaging of these flavored tobacco products are very appealing to young people, and that youth are looking for flavors in any product. So they start with e-cigarettes, they start with fruit, or they start with mint or menthol. You take one of the flavors away, they'll switch to another flavor, especially if they're addicted. You take e-cigarette flavors off the market, they'll switch to a flavored cigar or something else. So it's why, if you're interested in policy work, and I've done a lot of this, where it's important to have a comprehensive flavor ban. All right, so let me check those numbers. All right, keep going with numbers. Here are some of the flavors that are available. And usually when I do this in person, I can hear the audible chicken and waffles. Yes, chicken and waffles is one of the flavors. All right, there are over 15,000 flavors available across the products, across all the e-cigarette products that are out there. Now, when I first started doing this work in 2013, 2014, there was a CNN coverage of, I think it was Barbara Boxer, one of our California Congress folks, who was interviewing a CEO of one of the e-cigarette companies and was basically saying, how in the world can you have these flavors And the young person says, yeah, I agree. Wow, it looks yummy. The CEO of the vaping company basically said, well, we need these to help adults quit smoking, these flavors. Well, first of all, we could talk about this more in the Q&A. There's very limited evidence, really poor evidence, no evidence that e-cigarettes at a population level help adults quit smoking. So my sort of other take-home message, my preaching to you guys is please don't recommend e-cigarettes as a way to help adults quit smoking cigarettes. There are better ways. That's one. But the other is, let's pretend that e-cigarettes had a place, and it's possible if it was marketed right, if it was, there are a lot of ways that it potentially could have been helpful for adults, just not as it is now. But let's say, well, adults don't need all these flavors. Adults don't need unicorn poop and sugar booger and honey doo-doo and dragon's blood. They don't need those flavors. Those flavors are attracting our young people. And I'll show you some more marketing around it in a minute. So easy to hide. One more pop quiz for you guys, really quickly. How many e-cigarettes do you see? I'm only going to give you a second, but you can still look because I want to have time for the slides. All right, I'm going to give you the answer. It is 6. Let's see what, 4, 3 at least. All right, so 6. So you've got your Cigalike here, or vape pen. You've got your Juul pod, your Juul, your Soren. So Soren looks like a highlighter. Juul looks like a USB. Stig here looks like a USB. These look like pens. Teens tell us, and we've published studies on this, that part of why they use these products is they can hide them, and they can hide them in plain sight from their parents. Yes, thank you, Barbara. They do know how to, they did not. And it was a big issue for a long time when I've been working with schools for years, where schools would say, what's plugged into the computer or what's plugged into the wall. And so my team goes out and we do a lot of teacher training and parent training and youth training, but teachers to get them to recognize these products for exactly that reason. So you can again see how incredibly small some of these products are. All right, marketing. Yeah, it's impossible to keep track. It's impossible. All right, marketing. Just a quick shock and awe of some of these products being marketed to look like juice boxes. And, again, these products and the companies say we're not marketing kids. Come on, this is ridiculous what they're doing. So access. All right, access. Well, I told you the answer. All right, I told you the answer that the current U.S. and in California, the legal age to be able to purchase or to be sold to, because the onus is on the vape shops and the smoke shops and the retailers, not on the kids, which is good. We don't want to get the kids busted. We want to bust the people who are selling it to them. So it's age 21. When you see signs like this, and this is a real picture, when you see local discounts, student discounts, the majority of students out there are under 22 or under 21. When you're asking for, now, most of us in this audience went to school for 100 years, but when we're talking about students on average, we're talking around 21, 22. This sign is attracting our young people. Youth are price sensitive. A pack of cigarettes is about $10 in California, maybe a little bit more, $10.50. Puff Bar, the latest product that's super popular, you can buy it for $1 to $2.50. Okay, let that process. A pack of cigarettes is over $10. You can buy at least a pack of cigarettes worth of nicotine for $1. Juul pods, $4 for a 4-pack, or $16, $4 for one, the same thing. And they're being advertised as such. Misperceptions. Teens misperceive the riskiness of these products. They don't understand. Now you can say, well, come on, they don't have tar, they're not cancer causing yet. Okay, if you put me against the wall and say, come on, Bonnie, really which one? Probably cigarettes, I would still concede, are more risky, but hang on. As a friend of mine says, you can jump from a 10-story building and a 15-story building, they're going to have the same effect. Plus, with teenagers, we're not talking about cigarettes versus e-cigarettes. We're talking about e-cigarettes versus air. Remember that they are starting with e-cigarettes. So e-cigarettes are extremely harmful, and the concept of harm reduction or relative harm isn't really relevant to a teenager and to when we talk to teenagers. Plus, when you're talking about the addictive nature, they're all addictive. If not, to be honest, that because of the salt-based nicotine, that e-cigarettes are potentially even more addictive to young people than are cigarettes. And then stress, and I don't have a lot on this one, but we could talk about it, that young people are stressed out. We know that they're stressed out, and they're particularly stressed out right now during the pandemic. We actually have some data. I just haven't had a chance to crunch it and bring it to you, but studies more and more showing how stressed they are. We do know that teens are more likely, and papers have been published on this, are more likely to use any tobacco form, really any substance, if they're stressed. And we're starting to see that and concerned about that more and more during the pandemic. Teens think that they can self-medicate and feel better with using an e-cigarette, even though that's actually not true. But it's something, so we in our lab and in our toolkit prevention work really talk about how can you reduce your stress through ways other than through e-cigarettes. So just a quick summary, and then I'm going to give you a few resources, and then we'll have lots of time for questions. So e-cigarettes are a perfect storm to addict youth. They're stealth, they're easy to hide, they're youth friendly, they're blingy, they're cool. They're I talked to parents and educators during the pandemic, during Zoom teachings, and educators say, I think my kid, Johnny was using a vape because they were kind of covering their mouth the whole time and moving things away. It's really easy to use these products and really easy to hide them. Very high nicotine levels, and the kind of nicotine, the salt base, reduces the throat hit, easier to use, easier to absorb, easier to become addicted, and faster. They have misperceptions about the nicotine and the harms. There are flavors. I didn't even show you all the packaging and the ads, but you saw a couple. Didn't have time to show you all. They're cheap, but they are harmful. We do know that youth want to quit. There are more and more studies, including ours and others, showing that youth want to quit and they need help, but we have very, very few resources. There are no nicotine, FDA is not authorized or approved any nicotine replacement therapy for anybody under 18. Now, lots of docs, including the docs in my adolescent medicine group, I'm sure for you guys, are still writing prescriptions and recommending nicotine replacement therapy to varying success, some successful. Question then becomes dose. If you're using 41 milligrams and a patch is 21 milligrams, is that enough? Do you supplement with gums and lozenges? What do you do? We don't have any data on this. Right now, it's sort of guesswork and your clinic empirical work as opposed to published articles. So there are some ways and recommendations. Talk to all of your patients and their parents about tobacco and including e-cigarettes. Don't remind parents, don't smoke or use these products in the car. I didn't go into secondhand and thirdhand smoke, but it exists, and it exists heavily with these products. Encourage patients, encourage parents to talk to a healthcare provider about ways to quit. And reminding young people and adults, if they aren't e-cigarette users, keep the e-cigarettes and the liquid, the e-liquid, the juice, away from little kids and pets, because we have seen nicotine poisoning, and because they smell good and taste good, and little kids think that they're candy. So start the conversation. I'm using e-cigarettes with you, use vaping with young people, use the right words. I always tell parents when I give this talk, hey, go home and say to your kids, I just heard a talk on vaping. Can we talk about it? You're not going to find out whether they're using right away. It's an organic, a slow process, but having this conversation with them. There are some resources and you'll have these slides. There are some resources to help you and help young people quit, as well as prevent. And then I just want to quickly promote our 3 tools. I don't get paid for these, I promise. These are completely free resources that we encourage you all to use. Our tobacco prevention and cannabis prevention toolkits are mostly for schools to use, a bunch of curriculums to help young people stop using or not use in the first place, prevention. The visit one at the bottom is for healthcare providers. We got a lot of clinicians who said, can you take instead of an hour lesson to be used in a classroom, can I have a 2-minute lesson or a 30-second? So Visit is a very quick, here's a PDF, here's a fact sheet, put these on your walls, put these in your clinics, print them for free. All we ask is that you keep our logos and website on there. You don't have to use my name as the founder of these, and I always joke, I can tell you over a couple of glasses of wine how Jules stole some of our material. That's another story, but we're very protective. We have had other groups, well-meaning, who've taken our stuff and put them on as if it's, on their websites as if it's theirs. Just leave our info on there. Other than that, it's free. Use it. If you see an error, let us know. These are huge toolkits with lots of information. We do have our Healthy Futures curriculum. This is for young people who are using, and I should say Visit helps you understand and screen, counsel, and treat. So there's information on there. And these are all being built still. We fly the plane while building it. We're adding all kinds of new information. And then we have our Healthy Futures, which is for those who are using or addicted and you want to help them move towards quit. So I want to thank you. There's my email. I know that was a lot of information very quickly. I could have gone on for another hour. There's just a lot out there that I think is important for you to know. I'm going to stop sharing.
That was fantastic. Thank you so much. And for all of that info that we can freely use, that's really invaluable. Opening it up for questions here. I see that, Marina, you have if you're still on and actually can ask your question, you can go ahead.
I am, but I'm in front of an elementary school with a lot of children in the background. Maybe that's apropos here. Not middle school, but elementary. Thank you so much for that fantastic presentation. Really, really appreciate it. I was wondering, are there any evidence-based peer interventions or social networking interventions for adolescents in this area?
So I haven't seen, I should go back to it. We wrote a paper, which again, if you email me, I'm happy to send it. We wrote a paper on kind of a summary of the evidence-based interventions. First of all, a lot of them are not evidence-based or haven't been studied yet. I can't think of one that's specifically peer-led off the top of my head. People have taken, and in fact, we teach this too in ours, like, if you said to me, Bonnie, can you choose 5 lessons from your toolkit that would be best served in a peer-to-peer, I could give you those. And that would be, in a sense, evidence-based because it's based on our evidence-based toolkit. But I can't think of one specific evidence-based. I may be wrong, and I'm sure it's out there, but I can't think of one. The concept of peer-to-peer is definitely good and important, and people use peer-to-peer all the time. So I encourage people to use peer-to-peer. And if you want some, technical assistance in creating that, I'm happy to work with you.
Thank you. Yeah, the socialization aspect is really intense, and it's a key in so many of our areas of health behaviors for adolescents. So it's just interesting to think about how to impact that through peer-led interventions.
Yeah. No, I hear you.
Thanks for that question, Marina. Other questions? Feel free to unmute yourself, or if you can't, I'm happy to read your question off the chat.
Hi, this is Tony Young. Thanks for a really wonderful presentation. I was just wondering, you gave us a lot of really wonderful resources, toolkits, and so forth. I was wondering, in your experience, if we had to hand out 1 or 2 items to parents and to our teens in the clinics that we see to help educate them and motivate them either not to start or to stop, which ones would you recommend?
Yeah, it's a good question. It's hard to say one. One is the amount of nicotine. So that slide that you saw that comes down with the number of cigarettes in there, we have used that, and it's on our website as a PDF. So if you want to, you can either use a slide or a PDF. If you want to hand that out, you can, and that shows it. And actually it was great because we do a lot of work in Hawaii, sadly not in person. That would have been more fun, right? But we do a lot of work in Hawaii, and one of the counselors there printed that particular slide as a handout and had it on her poster, and she was doing some counseling with one of the students, and the student said, so-and-so, that's wrong. It's not 1.5 to 2 packs of cigarettes, it's one. And so she emailed me and said, Dr. Bonnie, I think that you're wrong. And I was like, no, actually we're right. And let me tell you why. And she went back to the student, and it wound up being this lovely conversation about the amount of nicotine, and whether it's 1 or 2 packs, it doesn't matter. The point is there's a lot. So I think that would be one that I would do. The other thing I would do is tell young people, and we used to have a slide, I have to find it again, but the concept that e-cigarette companies now are owned by big tobacco. So Juul is now owned partly by Altria, Philip Morris, RJ Reynolds, things like that. Because what you're doing is you're saying, look, students, young people, you hate the tobacco industry. You've been told for years you don't like to smoke. You know what? This is all from the same group. I think that's important. The other is you've been duped. So it's where the Truth Initiative has been so good. The concept that you're being targeted. We have something on disaggregating ads in our toolkit. You have to be careful because you don't want to show that flavor slide and be like, woohoo, flavors. You want to do it as a, hey, who's being targeted here? Do you want to be their replacement person? I often say 400,000 people die of cigarettes each year. You're a replacement smoker. We don't know about deaths for e-cigarettes yet, but you can say, a lot of people are getting sick and quitting. The tobacco industry, the e-cigarette industry is trying to grab you. How do you think they're doing it? They're doing it through cost and things like that. So I'd say that's another piece that I would probably go with. I think off the top of my head, those 3, and then the stress piece. Oh, the environment. We have some on our new Healthy Futures website. We have information on the environment and social justice. Some people are very concerned about, young people are about social justice, menthol targeting people of color. That's another way, environment and social justice, that works. Hopefully that answered and gives you enough.
Okay, thank you. That was very
no problem. Feel free to reach out to me, like I said, and I can put a little more thought into, 1 or 2 things that would be bite-sizable.
All right, thanks.
Thank you for that. Other questions? I'm scanning the chat.
Hi, sorry, I'm zooming in from my phone, but this is just like a lifelong trigger for me with how nicotine has negatively impacted my family and my friends, and now obviously our patients. And then I'm wondering if you have any kind of big picture advice about how we as voters and citizens can kind of promote policy that will help to rein in the big nicotine industry. Like recently I heard about one of the executives at Alto, that mail order pharmacy that's become very popular, used to be the top executive at Juul. And it's just so infuriating that these people from the nicotine industry are able to basically be present in our industry.
Yeah, no, it's true. Actually, somebody applied for a position of, I'm actually working with a company, good company, don't worry, to do some virtual reality cessation. And somebody applied to be a project manager. I won't say who, but from one of those vaping companies. And I said, absolutely not. Even if the person's supposedly a good person and has really good marketing skills, no way. So one is do exactly what you're saying, Jessica, is, say no, get them off and boycott or whatever you can do. But I think, the most important thing that you all can do, I do this a lot. I have a whole nother advocacy component to my talk, or policy. I guess we're not technically lobbyists or advocates, right? We're policy people, is, let's get flavors off the market. So Senate Bill 793 passed in August of 2020. I was not to toot my horn, but I was, and John knows this, I was one of the presenters in our state Senate in support of this, and one of their experts. It got signed into law on my birthday in August of 2020. It was my second best birthday present ever. My first was my husband taking me to see Bruce Springsteen. It was amazing. And then the next day, the tobacco industry sued. And so we are still, it's going to be on the ballot in November. Help get that passed. We need to get flavors off of all flavored tobacco out of this state. But in the meantime, city and county, find out if your city, find out if your county has, depending on where you live, has a flavor ban. San Francisco does. A lot of cities do, not all. If they don't, let me know and let's get that going, and I'll give you all the talking points you need. So getting that, let's get a nicotine standard in the US. Why are we allowing 5 to 7% nicotine concentration? The UK has 1.7%. Why are we allowing these vaping devices that could be hidden? The FDA needs to crack down. And then the other thing is the FDA in January of 2020, January 2020, I think it was, enforced the discretionary, discretionarily enforced, I always have to think of the legal way to say this, against pod-based, non-tobacco, non-menthol flavored. So Juul, basically those, but left allowed menthol. Kids just turned to menthol. And then they allowed all the other vaping devices. Let's get the FDA to act on all vaping devices, all e-cigarette devices as a class of products rather than picking one at a time, because kids just whack-a-mole on to the next one. And this is a problem. So feel free to email me for more. I'll put my email back in here. By the way, my two versions of my email are identical. One's just shorter. So don't feel like you have to use both. But please email me, and I would love to have you help. And we need healthcare providers to be on this. You know, we get a lot of parents, a lot of youth. That's fabulous. But we also need people who say, I've seen patients, and this is what I'm experiencing.
Thank you so much, Dr. Halpern.
Thank you.
You're welcome.
That was awesome. Unfortunately, we have to end. I don't want to go. It's been so great visiting with you. It's been really, really wonderful. So thank you so much. Take care, everyone. Have a great rest of your afternoon and rest of your week. Fantastic presentation. Thank you so much.
Thank you so much, everybody.
Take care.
Thank you.